Good afternoon. Thank you for being with us here on Thursday, July the 23rd. Dr. Dobbs will give us a full report here in just a few minutes about our numbers. He and I have both been studying the daily reports that come out on hospitalizations and capacity issues. We did have relatively good news today compared to the last 2 days, with slightly less than 1,000 new cases reported. We did, however, have 13 new deaths reported today. And as we have said throughout this process, we all agree that one day certainly does not a trend make, but the hospitalizations are also steady day over day, which is certainly not a sign of success, but it is a sign of hope. We certainly want to see stabilization in total number of cases and also in hospitalizations. We're a long way from saying that's actually happening, but today is a better day with respect to that than yesterday was. I do want to be clear with everyone across the state. We that are sitting at this table that have been raising the alarm over the last 3 to 4 weeks are not trying to induce panic. We are trying to make sure that there is a healthy respect throughout this state for this deadly virus and this deadly threat. There were times in this pandemic when fear was really over the top. Now, the pendulum has really swung, it seems, in which we have too many people who acting as if this virus doesn't exist. They're acting careless. They're acting as if they're only worried about themselves, they feel like they can beat the virus, and so why does it matter? I want to just sum up for those of you across the state as to why we are being so forceful in our honest analysis of where we find ourselves. So many want to talk about survival rate. That is, if I get the virus, am I likely to die? And we all know that the survival rate for this virus is certainly better than the 5 or 6% that it looked like early on. But we also know that the survival rate for this virus is significantly worse than the common flu. But I also want you to know, whether it's 0.25% or 25% survival rate for you as an individual, survival rate is not the only issue at hand. We have to also focus not just on the survival rate for each individual in the state, but also on our healthcare system as a whole. I would tell you that the category, and this is a 19-page report that the department does virtually every day about hospitalizations and other things. If you look at this, and I will tell you, I spend hours every day looking at these numbers. If you look at the categories of individual Mississippians who are contracting the virus today, and the categories that are growing the fastest, it is those younger individuals. It is those under the age of 30. It also happens to be those, by the way, that are in their teens. We're seeing significant increases in the number of cases amongst those 15 to 19. Certainly, the largest category of total cases are those between the ages of 21 and 30. And there is no doubt, while it can be very dangerous to that category of individuals, their survival rates are far greater than someone who's over the age of 80 or over the age of 90. But when you look at it from our perspective, we don't just look at it, what does it mean to you, the first iteration of an individual who contracts the virus. While that's important, it's not the only thing that is important. It's when that 27-year-old contracts the virus and then goes home. and gives it to a mom or a dad. Well, maybe that mom or dad is going to be perfectly fine as well because they are healthy. But what happens if that mom or dad is a primary care provider in a nursing home? And they take the virus because of this community transmission into that nursing home. Unknowingly, by the way, nobody is intentionally spreading the virus, or at least no one halfway sane is intentionally spreading the virus. But this is the iterations that we're dealing with. The young person gets the virus. They go home because they live with their mom or their dad. They give their mom or their dad the virus. Then, in the third iteration, the mom or the dad goes into a nursing home and gives that virus to somebody who's 75 years old, 85 years old, whose mortality rate is very different than the first person who got it. And so, I just want to be clear that when we are talking about the dangers of this virus, we are not focused on an individual 21-year-old survival rate. We're focused on our healthcare system as a whole. Because I can assure you that when all is said and done, when we get a vaccine, and we will, we're the greatest country in the history of the world, we will ultimately find a vaccine. It's not going to be me, but it's going to be the scientists in American pharmaceutical companies that come up with a vaccine. When all is said and done and we look back at the virus, we may find that the survival rate is much higher than we originally anticipated. But when we are talking about protecting our healthcare system, 10 years from now, when they look back at the survival rate of this virus, they're not going to take into account someone who was in an automobile accident that could not get the highest quality of care because there were no ICU beds available for that person in an automobile accident. And so as state leaders working with our hospitals and our healthcare space, we have to do everything we can to protect the integrity of the healthcare system so that everyone in our state that needs quality care, not just those who have COVID, but every single Mississippian can get that quality care. I've been accused of a lot of things over the last 6 months. Quite frankly, I've been accused of a lot of things over the last 17 years, and I'm used to it and I'm okay with it. But understand this, there is no incentive for me to sit here every single day and spread irrational fear. It would be far more popular and far more advantageous for me to get up here and say, you don't need to sacrifice at all. Everything's going to be just fine. It would also be a lot easier for me to get up here and make the popular decisions that so many other states have made to implement this or implement that. If every other state's doing it, then we'll just do it and we'll see what happens. But that's not why I ran for governor. I ran because I wanted to do everything in my power to make the hard decisions to make Mississippi a better place. And that's exactly what I'm trying to do every single day. I believe that what we are doing is the best path today to prevent more deaths in our state than have to occur. We're not going to stop the spread of the virus. We cannot eliminate all future deaths, but we can do the little things as a people by wearing a mask in public, by staying socially distanced, by avoiding large groups. If we'll do those things, I think we can make a difference. I do want to say to the people of our state, we are seeing more positive signs that you are taking this seriously. I want to congratulate you for that. I'm hearing more anecdotal evidence every day of healthcare workers who reach out to me and say, I can't tell you how much better I feel today because I went in a retail store and I was not the only one in there wearing a mask. In fact, everyone in there was wearing a mask. Our people are now paying attention again. I think that's very positive. We've got more work to do, but I do believe that our increased focus can and will have an impact. If we can get our citizens to wear a mask in public, to do the little things, we can slow down the spread of the coronavirus. Dr. Dobbs, will you give us an update on our numbers?
Yes, sir, of course. Thank you, Governor. So today we're reporting 982. It's kind of shocking when that seems like it's a good number. Still almost 1,000 cases reporting today. We are reporting 13 additional deaths. If we look at our hospital capacity, we see ongoing strain in the healthcare system. Our total hospitalized patients with confirmed coronavirus is 975. We've had a mild drop in our total ICU use at 278, but an increase in patients on the ventilators up to 163. Again, the ICUs are filled about 40%, essentially with COVID patients. So a big proportion of that is certainly straining the healthcare system. We have 8 hospitals with 0 ICU beds, but I would like to say thank you to the health systems and the hospitals across the state who are working very diligently to add additional intensive care space for you and your families. We've seen them add more beds online so that there's care available, but this is really a strain. You know, it's kind of like when you have to work 80 hours in a week when you're not used to working that hard. I mean, well, no one should be used to working that hard. But you know, it's something that's going to be hard to sustain. But I would like to thank them for bringing those beds online to take care of sick Mississippians. The other thing I'd like to say is with testing, please remember that if you need to get tested for coronavirus, you can use one of the no-cost state options. We still have the daily testing Monday through Saturday at the Old Farmers Market on West Street, so you can call and get an appointment if you need one. And today we have additional testing at Lexington and Tupelo. Tomorrow we'll be in Brandon and Heidelberg, and then on Saturday, South Haven and Pontotoc. So if you need to get tested for coronavirus, remember that that's an option for you if you think you might have been exposed or if you have absolutely any symptom of coronavirus. Thank you, Governor.
Thank you, Dr. Dobbs. This time I'm going to turn it over to Director Michelle.
Thank you, Governor. Just a couple of things I want to bring up. With regard to public assistance for COVID, as you've heard me talk here over the last few press conferences about the COVID Emergency Relief Fund, public assistance, which is open right now for counties and municipalities to make application on that. FEMA is going to be providing some online webinars for training for those counties and municipalities that may not be as familiar with how to file application under public assistance. Starting on Monday and running all the way through Friday on each day at different time zones, different times, FEMA will be providing Zoom meetings on topics such as grants portal application basics, COVID-19's applications overview, and emergency protective measures and donated resources. Those things will be provided. My communications department will list those on our website. Those will be listed by Friday, and you can go on and look at that and when those times are, and then the link for those Zoom meetings will be available. For those of you that can't make the scheduled times, there will be an on-demand YouTube videos that you can go in and capture those videos at your leisure. Just a tropical storm update. As you all are aware, the main storm that we've got the storm that we've got our eyes on right now, Tropical Storm Gonzalo. Things you need to know about this storm. This storm is moving out of the Atlantic into the Caribbean basin, and will do so over the course of the next few days. It's expected to be just in the vicinity, just southwest of Cuba on or about Monday. The storm also is a relatively small, compact system, which means it is going to be susceptible to environmental conditions, either both good or bad, depending on what those environmental conditions would be. So we're going to continue to watch this. This could be our first hurricane to enter the Gulf. We hope that is not the case. And because of that, I just want to remind everyone about the sheltering operations during a COVID environment. Sheltering operations, sheltering spaces are going to be extremely limited, more so this year than they were in seasons past. I want to remind everyone to plan early, to evacuate early out of the zone, and to make arrangements with friends or families or in hotels to evacuate so that you can stay out of congregate shelters. And we will be providing additional information next week about non-congregate sheltering processes and a way to get assistance to be able to do that. And then final note, I just want to thank the companies in Mississippi for coming to our aid and continue to provide us support. They come to us every time we need help. They're always there, and discussions as late as even 8, 9 o'clock last night with people that are helping us. So thank you very much for those companies in Mississippi that have stood beside us and been great partners. Governor, that concludes my update.
Thank you very much. I just want to give you one number, which I think probably better than any other illustrates what I was talking about a little earlier about the iterations of this particular virus. You may recall that we sat here after having a conversation with the presidents and the White House Coronavirus Task Force, and we put forth an initiative the last 2 weeks of May that over 14 days we were going to test every single employee and every single resident of our nursing homes and long-term care facilities across the state. Now, that was a monumental task that I tasked the Department of Health with. And now their partners at MEMA and their partners at our fantastic Mississippi National Guard, they developed a plan, they went to work, and within 14 days, they were able to get that done, just as we had asked them to do. What we found, and it was approximately 30,000 tests that were run, and because of that, we were able to reduce the number of outbreaks in long-term care facilities in Mississippi to a number that was less than 100, and I believe it got all the way down to only 85 statewide. Since that time, that number has doubled. I just looked on the website. That's what I was doing, was looking at my phone, looking at the data. We now have 170 outbreaks in long-term care facilities. We can look at the data. We know that someone who gets the virus that is over the age of 70 is much more likely to have a negative outcome than someone who is younger. But we had tested everybody. So by the end of May, we had tested everybody. And so those who had tested positive, we had been able to isolate them. But when there's community spread, the employees get it from someone else, and then it gets back in the facilities, and that's going to lead to negative outcomes for some of those residents. It's just, it's unfortunate, but it's inevitable. And so that's why everyone working together to slow the spread is critically important. With that, I'll turn it over to any questions. Cordian?
Governor, you talked about protecting the integrity of the healthcare system. We've seen the ask of the hospitals over the last several days, whether it be surge activations or ICU capacity, reserving some for COVID patients. Those are all downstream actions. What more can be done on the front end, or is that why we just continue to hear the plea for personal responsibility? I mean, the hospitals are, it seems, receiving the brunt of what's happening on the front end.
Well,
I mean, are we going to inevitably find ourselves in a bad place?
I would argue we are. I hate to say that we're in a bad place now, but we're certainly not in a good place now. You're right. The working with the hospitals is a downstream action. There is no doubt about that. There was always going to be the need for hospitals to step up because we are in a pandemic, and it's the pandemic the likes of which we hadn't seen in over 100 years. And I want to echo what Dr. Dobbs said. We are seeing some of our hospitals really step up. After our conversations over the last several days, there's a lot of folks making really hard decisions, and we appreciate that. It's important, it's needed, it's necessary, but many of them, not all, but many of them are doing the right thing, and we're very appreciative of that. But that is treating patients once they already have the virus, and so what we've got to do is we got to do that, because that's part of our mission, is to make sure that we're prepared with those plans, contingency plans, and then contingency to the contingency plans. But we've also got to look at what can we do to maximize Mississippians' participation in helping slow the spread. And so I do believe that we're seeing much more participation as it becomes more and more real, as more and more people know people who are hospitalized It certainly it seems to me that there is no doubt that there are Mississippians that are taking this virus much more seriously today than they were yesterday, and a lot more seriously today than they were 15 days ago when I initially issued the mask mandate in the 13 counties where we had seen the most spread. What other things can we do? We had a long conversation this morning about potential new orders. I think that there is no doubt that when you look at the age groups where the new number of cases are increasing at the fastest rate, the first age group where it's increasing at the fastest rate is those between the ages of 0 and 17, a 34% growth rate in new cases since July the 12th. The age group between 18 and 29 is the second fastest growing group, where you've had 2,359 new cases over the last 9 days. And that's a 30% increase over the total number that we've had over the life of this particular pandemic. So dating back into March the 11th, when we at least confirmed our very first case. And so when we look at that, we have to make decisions as to determinations as to why are those two groups the fastest growing number of increases, and what can we do to curb it. And so I think certainly when you talk about that 18 to 29 age group, we've talked about this for the last week, you're looking at bars, and I would anticipate that I will announce tomorrow some additional restrictions on bars throughout Mississippi. I would anticipate that it will be statewide. It will not be limited just to the 23 counties. It will be statewide. We want to make sure that that we limit the ability of those age groups where the virus is spreading the fastest to continue that. I think when you look at what's happening, for instance, in the over 60 age group, we don't get 100% participation, but they are doing pretty well. They are staying at home. You know, I've seen my mom once since mid-March, and I haven't seen my grandmom at all. And that it pains me to say that, but they're making wise decisions by staying at home and only coming out in public when absolutely necessary. But we're having a more difficult time convincing those in the younger age groups, particularly in that 18 to 29 age group. And so we've got to find a way to impress upon them the importance of it, and then, you know, it's a carrot and a stick approach. The carrot is to say, you know, let's not do that and let's do right. The stick approach is going to have to be at least partially what we've seen in Texas and Florida and so many other states where they've gone so far as to shut down bars. We don't want to do that, but we certainly want to make participation in properly following the executive orders more easy for everybody.
Real quickly, the data I know you guys have said shows that about 17% of any 1 day total of cases will end up hospitalized. Given that, and given the fact that we've had so many days of high numbers, do we believe the integrity of the system can be maintained over the course of the next, 2, 3, 4 weeks?
What I would say to you is, so the total new number of cases in the last 3 days, approximately 4,000. And so you'd have to believe, based upon history, and this is a pretty long history now dating back to March the 11th, almost 47,000 total cases. It is 17% hospitalization. And by the way, where we find ourselves now, if the younger age groups are growing at a faster rate, that number may tick down just a little, but it's not going to tick down a lot. And so we should anticipate that we're going to have somewhere in the neighborhood of 680 more patients if we have 4,000 new cases that just have been derived in the last 3 days. Now, to be fair, testing is not perfect right now, particularly at the private labs. And so some of these individuals probably have been hospitalized over the last day or 2 or 3, and so it's probably not totally 680 new. But when you think about hospitalizations, it is a lagging indicator. So those 680 people, let's just, again, these are all hypotheticals, but let's just assume that 150 of them probably are already hospitalized in the last 3 or 4 days. That still leaves over 500 that will probably be hospitalized. And Dr. Dobbs may have a better time frame, but in my mind, it's within the next 7 to 14 days, because that's kind of what we've seen over time. Now, that's the reason we've worked so closely with the hospitals and urged them to surge. We are treating the patients that need to be treated right now, but there is a real possibility that as we go over the next 10 to 14 days, that the hospitals get even more tight. We do not anticipate in the first half of August that there's going to be a significant downturn in total number of hospitalizations. At least that's my opinion. I don't know if you want to address.
No, I think you're exactly right. I mean, there will be some overlap just because of the delay in the labs coming in, but the other piece of that is it's not like we're going to have 0 cases tomorrow, right? So it's just going to keep stacking up as far as the eye can see. Can we keep up with this pace? Absolutely not. I mean, there's a limit. I mean, it doesn't mean there's not contingency plans, but it's not going to be the health care that you want to get on a daily basis. It's going to be a different kind of health care delivery than we expect in the United States.
Dr. Thurman-Winter has a question.
Yeah, I've got a question for Dr. Dobbs. I just wanted to see if you could speak more on whether increased testing is connected to rising COVID-19 cases, and can you just tell us what the positivity rate for tests has been recently?
It's been running about 15%. I can go back, but it hasn't gotten any better. It's not increased testing that's driving this. It's more sick people that's driving this. And we have been doing actually relatively, so I challenge you to drive by some urgent cares and see what's going on. And are they slow? Or are there people lined up at 8 in the morning to get tested? And why are they getting tested? It's because they're sick. Or maybe their family is sick. And so it's really sick people out there that are getting tested. So, but if you look at our trajectory of tests, they've been relatively stable. And it may well be as we get more information back, we've had a little bit of an uptick. But one of the things, and this is what the White House uses as one of their major indicators, is your percent positive. So our percent positive has increased. It hasn't decreased. If you're getting more tests, if you're getting more positive cases because of it's an artifact of testing, then your percent positive is going to drop. And we haven't seen that at all. Our percent positive has increased because we have a lot more cases out there. It's just out there.
Yeah, there's no doubt. That is absolutely correct. Joe.
Dr. Dobbs, focusing on children under the age of 18, what's the testing rate for those individuals, and are we under-testing them, and if you have a number by how much, that would be helpful?
I mean, we know how many kids are tested positive, right? And so I don't have an age-based testing rate, and we actually don't get the information on the negatives, so I can't really break it down. But I could give you a positive, rate per capita. But kids haven't been tested at the same rate as older folks, probably for a lot of reasons. Part of it is we've sequestered our children away from public. We haven't started school. We haven't done as many things, although I am worried about sort of the overexuberance of some of the summer sports stuff. I think it's a little bit reckless, to be quite honest. But kids get sick, and the younger kids don't get quite as ill, and so the likelihood of them getting tested is probably going to be less. But we have a substantial number of people positive, especially kids in the age 11 to 17. We've got thousands of kids in that age group that are positive.
3,443 tested positive from March the 11th until July the 12th. 3,443 over that 4-month period. In the last 8 days, these are age group 0 to 17, 1,160 have tested positive. So at this point, that's obviously a 34% increase in total cases the first 4 months versus the last 8 days. Yes, sir.
Governor Reeves, we've seen some school districts start to begin to delay their reopening process. What's your reaction to that?
Well, as I have said repeatedly over the last week to 10 days, there's a July 31 date at which the school districts are set to provide the Mississippi Department of Education their plans for reopening. I continue to believe that it is incredibly important that we put our kids in a position whereby they can learn this fall. I think that we need an option for in-school learning. Our districts have had months and months and months to come up with plans and to think outside the box, to come up with innovative ideas on ways in which they can safely get back in the classroom. And I anticipate that we will have some districts that, and I hope it's all the districts, that will be willing to produce innovative plans to get our kids back in the classroom in a safe, responsible way. The Department of Health has put out guidelines on some ways in which you can do this. And so I'm looking for our school district administrators to be innovative. I'm looking for them to think outside the box. I'm looking for them to say, here it has been opined by many, including the American Academy of Pediatrics, that there are certainly risks in kids being in the classroom given COVID-19, but there are also significant risks to kids not being in the classroom. And so, you know, when I think about some of the plans that I hope to see, that I hope are put in, are things like, okay, if we have a kindergarten through 12 school, perhaps we have an online learning option for those in 7th through 12th grade, and we use the entire school building to put kids K through 6 in smaller classrooms so that they can learn. Maybe it's something like, what if we brought in half the kids and we taught them school between 8 and 12, and the other half the kids came in and we taught them between 12:30 and 4:30. These are the kind of things that I understand are going to require sacrifices of lots of really good people. But I believe our kids' future is worth it. I really worry about that first or second grader that was having a hard time keeping up in February, but they were working hard and they were doing it. They were keeping up. If that kid that was struggling but worked hard and got through it, and for whatever reason hasn't had any learning opportunities since March, and that goes until January, or God forbid, next September, that kid's never going to catch up, ever. And we, as leaders, cannot allow that to happen. I believe there's a safe way we can get our kids back in school. Is it going to look exactly like it looked? No. It's not going to look... So, to all of our administrators, and I know they're thinking hard on this. I've talked to the State Department of Education. I know they're thinking hard on this. What I want you to hear me say today is this. If your mentality is, we are not going back into the classroom until there's 100% chance that we can do it exactly the way we were doing it in January of 2020, and there's 0% chance that anybody's going to get the virus, that's the wrong mentality to have. We got to be thinking outside the box. We got to be thinking, what can we do to make sure that we get all of our kids an opportunity to grow academically so that they can have an opportunity for success in life. We cannot let this virus keep that kid that was struggling but was keeping up never have a chance for the rest of his life. Okay? We can't allow that to happen. And so I'm going to get those reports hopefully sometime a week from now. And I believe very, very strongly in local control of our school districts. What's happening in the city of Jackson and what's happening in the town of Tishomingo with respect to COVID, as well as with respect to what's going on in their schools, is not one and the same. They need to have the opportunity and the ability to make different decisions based upon what's best in their communities. But the notion of we're not coming back to school until we can do it exactly the way we've always done it, that's not going to work out very well, I don't think. Renee?
Dave Elliott with WLOX has a question.
Thanks so much, Renee. Governor, on the issue of distance learning, it requires, particularly in the case of younger children, parental supervision. That's a lot to ask of parents. There are internet access issues in rural parts of the state. Thousands of Mississippi families simply don't have computers, iPads, or tablets. And even though they knew it would be coming, I'm curious what percentage of teachers are trained and prepared. How much confidence do you have in the so-called virtual classroom?
Thank you, Dave, for that question. It's a great question. What I will tell you is I had great confidence in the plan that the Department of Education put forward, in that I believed it could have been transformational if the legislature had actually enacted it the way in which they were asked to enact it. The State Department of Education actually did the right thing. They reached out to every single school district. They inquired as to what were the needs of every single school district, and then they developed a plan whereby they could meet the needs of every school district and therefore every single kid in every school district. But that was based upon distribution of funds based upon need. The legislature, in their legislation, decided to split up the money based upon average daily attendance, as opposed to based upon the needs of the individual school districts. Let me give you an example. There are school districts throughout our state that don't need money to buy equipment, because they are school districts that have already made the conversion where every single student in the district has that ability to have a laptop or a tablet or whatever the device is that they chose. They don't need money for that. And so, but there are other districts that need more money. And so I think there will hopefully be some conversations over the next couple of weeks about if we were to have a special session, is there a way in which to get every district the money that they need? Because again, we have got to get away from this mentality of we're just going to treat everybody the same and we're going to give everybody a little bit of money, rather than let's focus on giving the kids who need it the most, that don't have certain devices, that don't have certain capabilities of distance learning, the ability to do that. The other piece of that, Dave, which you mentioned, which I think is important, and that is teachers and the ability to properly teach with distance learning. That's hard. There certainly needs to be money available for districts so that they can do teacher education. We've got literally tens of thousands of great teachers throughout the state of Mississippi, and I'm confident that they have the ability to augment in classroom teaching with distance learning. But there certainly needs to be professional education as an expense that goes along with that. I believe that these notions of hybrid plans, in terms of having some students in the classroom, some students distance learning, the innovation that might provide is a good idea, and one that I'm hopeful that the large number of school districts out there that have been thinking through this will offer as their plan an approach where they meet the needs of every single student. Because it's not about the school and it's not about the district. It's about each individual kid in that district. Yes, sir.
You mentioned earlier, like schools looking into different kind of plans to try to prepare for students, and if they do have students come back every day, maybe having them come in and out. Like, do you think there's any importance of getting extra funding to those school districts to provide, extra bus routes? So like middle of the day we can swap students, or like more cleaning staff to come in and desanitize or resanitize all the desks and things like that.
Yeah, there's no doubt that there has to be there's going to be some additional expenses in some of our school districts if they are COVID related. There's hundreds of millions of dollars that came in the CARES Act specifically for schools, and we're going to have to utilize those monies in a smart way to make sure that we do the right things to protect our kids. Renee?
Kristen Garris with WHBQ has a question.
Hello, how are you doing? I just wanted to ask a little bit more about the hospital bed shortage. What are your concerns about that, and are there any plans in place to possibly have like an alternate site to try and overcome this?
Yes, there are plans in place. We have a contingency plan, and we have contingency plans to our contingency plan. But the first course of action is that the vast majority of hospitals, particularly the tier 1 and tier 2s, have surge capacity on paper that they can implement, and a number of those are doing just that right now. And so that's the first line of defense. That's the first step that needs to be taken, and I'm confident that they will do that, and that will relieve the pressure, at least in the short run. It may not be a long-term solution. Depends on if we can roll over on the total number of new cases, but it certainly is important for the initial approach.
Yeah, and there are a lot of things that can be done, and at some point we may well have to open up a ward-style location in a non-traditional place like you've seen in other states. I regret that we're getting to the point where that's a real reality, but we're looking at the logistics of doing that and the logistics of staffing those sorts of situations. So the best place to get care is in your local hospital. But if you can't get that, then we'll have to find another way that maybe is not going to be as optimal. But we need to make sure people can get taken care of, even if it's not the way that we would normally want to.
Just to give you an example, there are currently in Mississippi 10 facilities with 0 ICU bed capacity, no ICU beds available. In those 10 hospitals, according to the data that I have, there is approximately 115 ICU bed reserve capacity, whereby they could flex up and open additional ICU beds. Now, I will admit, and I think everybody up here will admit, it's easier to write a plan on paper than it is to turn that spigot on overnight, but there's 105 beds. In addition to that, in those facilities that have less than 10% ICU bed availability, there's 11 of those in Mississippi, and they have somewhere in the neighborhood of 100 plus available ICU beds. Again, there's things that we have to do, and that's the reason we had a long, very productive call with our hospitals yesterday that can relieve the pressure in the very short run. But we've also got to be building our contingencies, which we did back in March with our emergency management agency. If we need to have a step-down facility with beds, then we will take the necessary steps to do that. If we need sort of a MASH-style 100-bed facility where we are putting patients, we will take the necessary steps to do that. Keep in mind, the quality of care in those facilities are not going to be the same level as if you go to a level 1 facility in Mississippi today. They're just not going to have exactly the same level of care. Now, that happened in states all around the country in March and April. It happened in Louisiana. It happened in New York. It's happened in New Jersey. It's happened in Georgia. It's happened in states all around the country. It hadn't happened here yet, but we will be prepared if that is what we have to do. Just understand that the quality of care, and I'm not a physician, so I can't speak to the specifics, but I am convinced that the quality of care in a setting such as that is not likely to be what you are accustomed to. Yes, ma'am.
2 quick questions. Is it 8 or 10 with 0 capacity? Earlier I had written down 8.
Well, and the governor is correct. I had discounted the long-term acute care centers, and so he's technically correct, but I just kind of discounted them because that's not a place that we would normally put, routine critical care folks.
Yeah, of the 10 that I mentioned, 2 are long-term acute care facilities. So,
Yeah.
look, always go with his number. We'll go with 8.
So the other question is, when you account that 17%, you know that COVID patients in particular, they're taking up significant amounts of space. They're not leaving the hospitals very quickly. They're longer term stays from all accounts that you guys have told us. So how far off, you said you regret that you're even having to say this as an option, but realistically, know that we don't have a date, but it seems like at some point when you start figuring up those numbers and say, well, this many cases for this many days, 17%, we've got to have something by, this time to have a place for these people.
Well, and what would most likely happen simultaneously is sometimes the hospital rooms are pretty big, right? So you may not have a private room anymore. That may become no longer an option. We have a lot of space, like in, say, a procedure suite. Normally we don't put patients in there, but we're going to be sticking patients in every nook and cranny of a hospital while we're standing up that capability. It's going to be stressful to work in a hospital. I would want you to thank your neighbors and friends who work in healthcare, because it's been tough up to now. It's about to get even tougher. But there is some more, sort of like a sponge, you can soak up a little bit more. Don't know how much that's going to soak up, and staffing is going to be the main restriction, unfortunately. But unless something changes, and it's in our power to change it. If everybody would just behave for 2 weeks, we'd see a difference. But everybody wants to go do what we did before. People want to go play baseball and hang out with grandma and go to the concession stand. It's maddening. I don't get it. Now's the time to stay at home, wear a mask, and stay away from people. That's it.
And let me just say this. In a normal July, and July may not be great because hospitalizations are down typically in the summer, but on a normal day, we have ICU capacity issues in Mississippi anyway, right? I mean, that's just part of it, and that's true in any rural state across the country. You've got your level 1 facilities, your tier 1 facilities, you have tier 2s and 3s and 4s, and ICU capacity, particularly in your tier 1 facilities, are always an issue. But you said something that I think is really important to understand, and that is the typical ICU stay for an automobile accident or for a surgery or other things is very, very short when compared to the typical ICU stay of a COVID patient, who is 21 to 27 days. I mean, it's 3 to 4 weeks that they tend to stay in that ICU. And so that's what we're dealing with. You have a lot of turnover in a normal day because you have a lot of people come in, but a lot of people go out. Right now we have a lot of people going in and not a lot of people going out. And unfortunately, those with COVID, a lot of them, their outcomes are not particularly good.
CJ Lemaster with WLBT has a question.
Hey, Governor. Hey, Dr. Dobbs. I have a question and then a quick follow-up. The latest numbers from the Department of Health show an additional 18 counties that should also have these greater restrictions. That's from our analysis, and that's based on the criteria that you've mentioned several times. 200 new cases over 2 weeks, or 500 new cases per capita per 100,000 people at the same time. Can you share with us when you'll be amending your order to include more counties? And of course, I'll have a follow-up after that.
Yeah, I would anticipate an amended order adding counties tomorrow.
Okay. We're not 2 weeks into the first restrictions involving those original 13 counties. We have seen significant drops in new cases in Claiborne, Jefferson, and Grenada already. May not be related to these restrictions, of course, but this is for you, Governor, and Dr. Dobbs both. Can you give us an idea of counties that might be dropping off the restricted list?
That's a great question, and I appreciate it. I think the way in which I would answer that is we have seen a downturn or a downtick in the number of cases in a number of counties, but it's not because I wrote the words on the page, okay? It's because the people in those counties decided to participate in protecting themselves and protecting their neighbors. My guess is that we will, because it's been less than 2 weeks since we put those additional measures in, I don't think we'll take anyone off tomorrow. I think we'll probably let that go at least another week in all the counties that are currently on it from the original 10 that we put on. But your point is so incredibly important. It's what I've been talking about for a month now, and that is, if we identify a county, and if the locals, the leaders, the religious leaders, the business leaders, and yes, the government leaders, if they recognize the importance of participating in wearing a mask, staying socially distanced, and even enforcing orders. You know, we've got a few mayors, not all of them, but very few. They don't even want to enforce less than 50 people at a baseball park or less than 100 people at a baseball park. They want it to be the wild, wild west. But in those communities where they're bought in, it can make a difference. And that's the most important thing that we can take out of today's press conference is there are counties, and there are a lot of them, by the way, that we have put additional restrictions on that have bought in, that we are seeing at a minimum a flattening, and in some cases we're actually seeing a downturn in the number of cases. That's the outcome that we want. We need it statewide, but everybody in the state needs to participate, and we will be looking to use those criteria to add tomorrow. I don't remember the exact number, but initially the request was that we have those mask orders for much longer than the 2 weeks that we initially put them on. We said let's put it on for 2 weeks and then let's gauge the data. I think we'll extend those a bit. We'll continue on the counties that we currently have, but I would anticipate that there will be some additional counties added tomorrow.
Patrick McGee at Sun Herald has a question.
Dr. Dobbs, I want to make sure I caught you right earlier. Did you say it's now 163 on ventilators?
Yes, sir. That's just the update I just got, the spot update from my team just a minute ago. Yes, sir. 163.
Jack from Planning Ledger has another question.
Yeah, Governor Reeves, I was just wondering if you could give us an update on your picks for the Flag Commission.
Yeah, I hope to have those done soon. As I mentioned yesterday, we're working hard. The team is to do those things. We announced or will announce an additional Chancery Judge appointment down in the south part of our state. On Tuesday, we announced a Chancery Judge in the north part of our state. So our team that focuses on appointments is working very hard to get recommendations to me so I can make those, and I hope to do those very, very soon.
Bonnie Harrison of Mississippi Today has a question.
Hey, Governor, this won't take long for you to answer. I heard you mention special session a while ago. Is there any chance you could do that as early next week, or is it going to be later than that?
No, it will not be early next week.
Dave from WOS has another question.
Question for Dr. Dobbs having to do with contact tracing. Dr. Dobbs, in a business or a state agency for that matter, if someone tests positive, what should the protocol be? What is ownership or management obligated to do in terms of naming the person, telling coworkers, and trying to find out what clients, customers, or people that person may have come in contact with, all while dealing with HIPAA rules and regulations?
Right. No, so part of that answer is easier than other parts. So ideally, in a more controlled environment, that we would take a lot of that responsibility. But just for a lot of practical reasons, and also the fact that we're not getting results back, from most of our private labs quickly, and we have, 8 times more cases than we had when we were starting this endeavor. There is not the timely contact investigation that we would work for, but we're adding folks, and we've been adding folks. But I will say that we do have on our website, we work with our physicians to go ahead and put or give the identified cases the isolation information that's needed to protect their families and the coworkers. We've had a lot of conversations with different organizations, businesses, and we do have the information for quarantine. And this is going to be the same thing for schools, because we're going to depend upon the schools to identify who needs to stay home from work. And these are normal business operations that you would need to know how to do to make sure that you keep your operation safe. And essentially, anyone who has been exposed to a coronavirus a person with coronavirus for 15 minutes within 6 feet or less needs to be on quarantine. And quarantine's a 14-day period where you basically need to stay home and see if you get sick. We do recommend people who are contacts also do get tested, but a negative test does not remove the need for having quarantine because you can turn positive later on within that quarantine period. So yes, businesses, agencies, please use the resources we have. It doesn't have the same sort of legal binding that we have been trying to do through our sort of public health authority, but let them stay home for 2 weeks. See the rules. It'll be pretty obvious what the best practice is. It's something that we're all going to have to take responsibility for. Unfortunately, there won't be the as much of an intervention one-on-one with health department personnel, at least not right now, until we can both staff up sufficiently, get our labs reports coming in more timely, and then get a lower caseload. If we had 500 cases a day, we'd be all over every one of them, but or 400 a day. But 1,600 cases in a day is absolutely unbelievable.
Joe?
Dr. Dobbs, are we seeing any long-term damage as far as effects, as far as someone who was critically ill under COVID? What kind of effects after they get rid of the virus are they experiencing?
Oh, absolutely. Most of the effects that we've seen so far are going to be organ damage. If you're extremely ill and you go into kidney failure and your kidneys never recover, then you'll be on your dialysis or have a transplant. So it's that sort of damage that we're going to be seeing. Other common things, we're seeing cardiac issues and heart failure, and that's going to be long-term damage. We're also, and the more common thing is going to be lung scarring related to lung damage. And so we will see a lot of debility and physical restriction from the long-term manifestations of organ damage. Now, there are also some weird autoimmune things we've seen, and I suspect we'll learn more as we go through it, and there might be some other sort of strange, more coronavirus-related things. But for anybody who has to go on mechanical ventilation for respiratory failure and or has kidney failure, those things happen long before coronavirus, and there are well-known long-term problems for a lot of people who have to go through that sort of ordeal.
Renee?
CJ with WLD team has another question.
Dr. Dobbs, I know we've been doing these Mythbuster questions quite a bit lately, but I have to ask you, when you see someone say survival rate, or when you see somebody say, well, everybody who hasn't died of coronavirus has therefore recovered, can you break down why statements like that are inaccurate, and why, Governor Reeves said yesterday that roughly around a fourth of the U.S. cases have fully or have presumed recovered. In Mississippi, that percentage is higher, but the criteria could be different. Can you just kind of describe that to us, and why survival rate per se may be a misnomer?
Well, we have to be careful about selecting statistics to validate a pre-existing thought process, and everybody does. Me too, and I get it. And actually, that's one of the main thrusts of a graduate course I teach at UMC, is how to interpret data and how to have scientific reasoning. The survival rate, first off, for people who were sick in the hospital, is probably better, because we're able to take care of folks better and understand what's going on. We don't need to look at a broad statistic. We need to look at a specific statistic of individual people monitored over time who are like enter a hospital or become sick. There are going to be a lot of factors that go into this survival rate calculation. First and foremost, if we have a surge of young people, their survival rate's going to be lower, right? We know that. That's great. We don't want young folks to die. But what's going to happen is over time it's going to spread through the population, and more people are going to die. The other thing is we know that hospitalizations and deaths are a lagging indicator. So if we have a massive increase of cases and we're using historical deaths, of course your survival rate's going to look better because people hadn't died yet. So it's really kind of it's a false metric that people want to be reassured about so that we can do things we don't need to do. There are a lot of dead people out there. There are a lot more dead people who are going to be here, a lot of loved ones who are going to be lost. And then splitting hairs over what we should be excited about is absolutely maddening, because we can prevent every single one of those deaths. We have just chosen not to.
Well, and I think another way to look at it, and it's always been confusing to me, because if you look at the rates, for instance, in K through 12 education, if you look at the graduation rate and then you look at the dropout rate, it's always been maddening to me, to use one of Dr. Dobbs's terms, why those don't add up to 100%, but they don't. They never do. Here's the reality. We have just shy of 1,500 deaths in Mississippi today. And are we supposed to be pleased if we have 1,500 deaths and a 1% death rate or a 99% survival rate, rather than, or are we supposed to be more pleased if we have 3,000 deaths and a 99.5% survival rate? That doesn't make any sense to me. Every one of those lives is important. Every single one of those Mississippians is important. And so for those individuals who want to focus on survival rate and do nothing, I mean, I understand. Look, I think Mississippi's probably had businesses closed for a shorter period of time than 47, 48, 49 other states. Nobody wants to do the things that we're doing, but doing nothing is just simply not an option. I can't get up and look in the mirror every day if we're not doing anything to try to slow the spread of this and protecting every single Mississippian. And I believe in my heart that 99.9% of Mississippians agree with that statement. We can do simple things that are a pain, that are not what we want to do every single day. Wearing a mask is not fun. I get it. I don't like it either. But we know that it works. And in fact, we're seeing it in some of our counties where we're getting strong participation. The number of cases, the amount of growth is slowing. That's what we want. And that's what we need.
And we don't need the Sun Herald has a question.
Here I am. I'm sorry. It takes me a minute to get to that unmute button. I wanted to thank all of y'all for taking the time to answer all our questions every day, because I know you're very busy. This question actually came from a reader, and given the increase you're mentioning in 0 to 17 cases, I'm wondering, Dr. Dobbs, if you all have done any investigation or contact tracing that indicates that any of these cases are coming out of summer camps and day programs for kids in the summer, and if so, what that does portend for school starting back.
We don't have as much information on that as we would like, but we do have some information about specific things. We do know we had a lot of cases around a bunch of teenagers having some outdoor get-togethers in the Jackson area. We do have cases related, although I can't say it's an outbreak, but cases related to summer sports. And we do know that there have been outbreaks in other states, so we can extrapolate from, well, not just certainly baseball games and stuff like that, because it does happen. Outdoors is not a panacea. It's not going to prevent all cases. But bars, we have huge outbreaks in bars around the country. So there's nothing magic about it. If you put people in close proximity, we know that teenagers are just as likely to spread it as young adults, and just as likely to get it. It's just going to happen. And if it's a outdoor bar or if it's an outdoor barbecue, and the risk is the same. It's just people being close together, breathing on each other, and people are just going to get it.
Alex from Mississippi Today has a question.
Hey, sorry. I was wondering if you've noticed any correlation in the counties that have had the mask mandate so far, and any promising numbers there so far?
I would say that there is not enough data to make a definitive response, but in I think anecdotally, I can tell you that I feel confident that the number of people who are wearing masks throughout the state is better today than it was 2 weeks ago. And there are some counties that are appearing to slow total number of cases just in the last 7 days. And we do know that when we instituted stricter measures in Scott and Neshoba and Leake and Atala and Jasper counties back 3 months ago, it certainly helped to slow the spread there. So, but I don't want to make a definitive statement on the 10 counties that we implemented 2 weeks ago tomorrow, but there is some encouraging evidence there. Wearing a mask, staying in smaller groups, staying 6 feet apart, makes a difference. There is a consensus and an even more and growing consensus that will and can make a difference, and I think it will make a difference here. Yes, sir.
Governor, why would you not want to call us a special session next week to try to get that budget for education before the school starts back?
I don't think it's necessary. We have done that in such a way where we can make the MAEP transfer. We are still only about 20 days past when a large number of cases occurred in the Mississippi legislature, and I don't believe it's safe to bring them back and put them in the Capitol at this juncture.
Director Ledger has another question.
Yeah, I should have.
And oh, by the way, hold on a second, Jack. There are still legislators in the hospital. So if I brought them back next week, they would be down a number of people because they still have legislators in the hospital from the virus. Sorry about that. Go ahead, Jack.
Sorry, no, I had a quick question for either you or Dr. Dobbs. I had a reader reach out to me concerned about, I guess, the bar exam that's going to be taking place next week in the Jackson Convention Center. There's going to be over 100 people there set to take it, he tells me, and masks are required, but he was concerned. Wanted to know, how you guys feel about such a, holding the bar exam right now during this pandemic.
And certainly there are guidelines out there, and if you have big enough space and the proper planning, 100 people is manageable. It's just a matter of having the the fidelity to the plan to make sure that people are safe. But I would think that the lawyers are pretty good at following the rules, so or knowing the rules, right? So,
Yeah, I don't know any of the specifics. I don't think you'd want 100 people in the room that we're currently in taking the exam, but in the convention center, my inclination is to believe they can rent enough space where they can do it in a safe way.
Yeah, I would think so.
I'm not saying they are or they're not because I don't know the details, but I think they could. We've been here an hour and 10 minutes today on Thursday. Thank you all for being here. Thank you for what you're doing to relay this information to the citizens of our state. I do believe that more people are paying attention, more people are participating in making sure we work together to slow the spread, and you play a critical role in that. And the fact that we've got 18 people on the call and 3 or 4 others in the room, I think is really making a difference. So thank y'all for what you're doing. Stay safe out there, Mississippi. God bless.